Will a person on regular TRT have an advantage in the gym? The short answer is no, absolutely not. If they're on a program, if it's regulated and they're within the norms, then they have zero advantage in the gym.
What's up, guys? In this video we are going to talk about testosterone replacement therapy, otherwise known as TRT, because this is something that I have been interested in trying for myself for about a year or so. Basically, for those of you who don't know, when men get older, they stop producing as much testosterone as they produced when they were younger. And it's responsible for, it's easier to make gains in the gym and you recover faster and you're more confident and your sex drive goes up and all these amazing benefits. And there is now the option to do doctor supervised testosterone replacement therapy where you go to a doctor and they prescribe it to you and it's this whole thing. So anyway, I've been looking into it. I've been reading a lot about it. I've been watching lots of videos about it. And I still have some reservations because a lot of what I'm hearing from the TRT community on YouTube, and really just in general, anybody who's a big proponent of it, there are some holes in their logic that I am going to explore by watching this video right now. So disclaimer, I'm not a doctor. This guy seems like a cool guy. This is not a dig against him or anything like that. I'm just trying to figure this stuff out on my own. And I'm using this specific video as a way to illustrate some of the concerns that I have about it, some of the things that don't make sense to me. Super exciting.
Testosterone is considered a steroid. So a lot of people have mixed ideas about it. Is it cheating for people that are on TRT? Are they getting some sort of enhancement or boost over a natural athlete that's not on testosterone? So I want to discuss that, and basically the topic is, does TRT, testosterone replacement therapy, give you an advantage in the gym? So yes, testosterone is considered a steroid, but unlike most other steroids that bodybuilders take or sports performance enhancing drugs, testosterone is naturally occurring in your body. And the whole point of TRT is what it does is it replaces what your body is naturally not producing, okay? So people that are on TRT are basically getting subsidized, or they're getting extra testosterone over and above what their body's producing, but that's because their body isn't producing enough.
Okay, so this is my first problem with testosterone replacement therapy. Now, to be fair, not a dig at him. He's a great guy, amazing. Everybody who does TRT is a wonderful person and all that. I'm thinking of myself here, and that's why I'm looking at this, and I'm just using this as a backdrop for me to voice my concerns. So, what did he say? The whole topic of this is does TRT give you an edge in the gym? And this is this is a very good metaphor for why people actually do TRT, because it gives you an edge in the gym. It gives you an edge in every area of your life based on what these people say. So the idea is that, well, if you're doing TRT, will you have an edge in the gym? And he's like, no, you won't have an edge in the gym because you're only injecting enough testosterone to get your body back up to its within the normal range of what it's supposed to be, which is between 400 and I think 1100 or 1200 nanograms per deciliter. Now, what's the problem with this? Why am I crying about this? Because a healthy young man will produce between 4 and 7 milligrams of testosterone per week in the testicles, and a TRT dose of testosterone. It's very rare that I see a dose that's under 100 milligrams per week. So it doesn't make sense to me how your testicles will, a young, healthy, natural man will produce 50, let's round it up to 50, and you're going to inject 100. How does that make sense, right? That doesn't make sense. And the justification for this is that, well, it'll bring your total testosterone levels up to within the normal range. So it'll bring, this number, whatever the number is, to a higher number in between 400, really 400 and 1100. So that doesn't really add up to me, right? Theoretically, you should only need to inject what your body would actually be producing normally, right? Let's say, God forbid, you were castrated or something, and you were producing zero testosterone, you would inject 50 milligrams because that's the maximum of what your body would be able to produce anyway, right? So like what I see in the TRT community is that this treatment, this protocol is justified with like medical language as a way for guys to essentially do an extremely low steroid cycle for their entire life in order to reap the benefits of way higher than normal testosterone levels, which is fine, to be fair. That's why I'm considering it. But I just wonder, I want to clarify that that's actually what this is. And it seems like it is what it is. So we'll see.
But let's get into, now we've kind of basically already talked. I have my first point is, first off, what is TRT? We've kind of discussed it. It's a replacement therapy. Again, for the testosterone, your body is lacking. So your normal ranges should be in a certain threshold. If they're below that threshold, a doctor can prescribe testosterone to get you back into those normal ranges, okay? Not above or below, but typically I believe doctors would want to get you on the higher side, but still within norms. You know, their whole goal is to make you feel better, get you back to feeling healthy again. And we'll talk about some of the side effects in a second. Actually, let's do that right now. So what are some of the side effects of low testosterone? Well, for men and women, it can be the same too, but low sex drive. Now for women, or for men, it would be difficulty with erections, not for women there, obviously. Fatigue and lack of energy, that could be women and men. Loss of muscle mass, to some extent women, but a lot for men. Increase in body fat, again, men and women can, testosterone is a metabolism booster, puts on muscle to some degree. If you don't have it, you're going to have a little less muscle than you should normally have.
You hear this guy emphasize several times, it's doctor approved, it's covered by a doctor, these clinics exist and there's doctors there. Because what it seems like to me is that all of these guys who are doing TRT, and really a lot of these like TRT YouTube channels, they kind of push this idea that testosterone is this like healthy thing that's going to like make you live longer, and it's going to have a higher quality of life, and there's no risks. Well, to be fair, they don't say there's no risks. There are things like suppression of your natural testosterone, and like potentially like your estrogen might get too high through aromatization and like all this stuff. Okay, so there are minimal risks, but assuming all of those risks are taken care of, right? Like assuming all of those risks are taken care of, what's the risk? Right? I'm actually asking, what is the risk? Is there still a risk? You take a guy who's doing TRT, quote unquote, perfectly. Is he still at risk, right? Is he going to die 10 years sooner because he did testosterone replacement therapy? That's really what I'm trying to figure out. Is he going to have a lot of health problems later as a result of, doing this, right? That's really what I want to know. And all of these like kind of behind the back arguments, I guess. I can't really think of the right word for it, but to say like, oh, well, TRT is healthy because there's doctors who prescribe it. And like, these are actually the symptoms of low testosterone, and TRT will take care of those. Okay, well, that's great. Cool, awesome, amazing. But that doesn't answer my question, which overall, long term, is this something that is going to have a net negative effect on your health? And that's not something, unfortunately, that anybody can really answer, because there have not been any studies on this, because it's a new therapy, and to do a study on this would take like actually 50 years, because you need to track people doing it, for example, from their 30s to their 80s or their 40s to their 90s. So it's kind of in a tricky situation, I guess.
So what are normal prescribed testosterone levels? It really ranges. Everybody responds to testosterone therapy differently. Some people can be as low as 100 milligrams every couple of weeks. That might be a starting point with you and your doctor. Some people may need as much as 300 milligrams every week. That would be a little bit rare, but usually it's between 100 to 200 every week or two, okay? So that's pretty normal. Now to give you a context of what a bodybuilder would use for like taking steroids, your traditional, they're taking steroids for such and such to get, enhanced muscle growth. they're starting out at like 500 milligrams a week. That's like your starting point, okay? So 3 times above what a person on TRT would be taking. Now keep in mind, that's the testosterone they're taking. They may be taking other orals and other injectables at the same time, stacking with other performance enhancing drugs. And they can even be taking as much as 2,000 milligrams, so 10 times the amount that a TRT person would be on of testosterone per week.
When he makes the comparison between a TRT dose to a full-blown cycle that a professional bodybuilder would use, or a amateur bodybuilder, whatever, it's a little bit of a straw man argument, right? What's the issue? Like, first of all, to go back to what I said earlier, your testicles produce 50 milligrams per week, best case scenario, right? From what it sounds like, based on what I've read, 4 to 7. I've read that a couple times. And that's a young, healthy man. So 50, let's say 50 milligrams. Your body produces 50 milligrams a week if you're a healthy person. How does it make sense that you're going to inject 100 or 150 or 200 per week? It doesn't make any sense. Also, from what I've read, it's very rare, like unheard of, that anybody is going to inject 100 milligrams of testosterone once every couple of weeks. Why? Because the esters, the types of testosterone that people use for TRT are either cypionates or enanthates. I might be pronouncing those wrong, but these take about a week to break down in your system. So they last for about a week, basically. But the problem is that when you inject on the first day, you feel very good, and then when it wears off, like when it starts to wear off at the end of the week, you feel kind of bad. So you have a lot of people who will modify their dosing schedule, and they'll do let's say their dose is 100 a week or 200 a week. They'll do 100 every 3.5 days, right? Instead of doing, and in that way they break it up into 200 a week. So that right there, a little bit inconsistent. What he said about a bodybuilder dose, where he started out, he's like, they start out at 500 milligrams per week. That is commonly, that's like the newbie cycle, right? It's like the newbie steroid cycle is you do 500 milligrams of test per week. That is what a lot of people in the bodybuilding community who do steroids recommend. However, it's like a huge amount of overkill, right? The idea is that, like, if you do 500 milligrams per week, the difference between doing 500 milligrams a week or 250 milligrams a week or 300 milligrams a week, you're not going to grow as much, but the side effects are still going to be the same. Things like acne, hair growth, or hair loss, for example, like all of the sides will be the same, but you're leaving gains on the table, is what they said. And what he said about people doing like 2 grams of testosterone per week. Yeah, if you're like preparing for, Mr. Olympia, maybe you'll do 2 grams a week. And maybe some idiot in the gym is like blasting 2 grams a week, but that is like an insane, like that's way more than you need, right? Like, to be fair, I've never even injected it once, right? Never done testosterone in my life, but I've read a lot on the internet, and it's like a straw man argument. Why? Because I think this guy, and I don't mean to pick on him, I really don't, like, respect to this guy for sure, but it seems like he's just justifying this choice that he has made. And this is an attitude that I see mirrored in a lot of other TRT YouTubers who are like, yeah, I do 150 a week. It's super healthy. My doctor gives it to me. And there's all these benefits. And like, everybody's really happy at the end of it. And like, there's no bad side effects. Don't ask, because the doctor said it's okay. So it's like, you see why I'm like a little bit worried about this?
Now, will a person on regular TRT, what is my question here? Will a person on a regular TRT program have an advantage in the gym over a person who is not on TRT? So this is the thing, right? Because, I'm fairly muscular, I'm fairly lean. Pretty much everybody, or a lot of people on YouTube who've built themselves up, have a certain amount of muscularity. There's certain, especially when they get lean and veiny and stuff, all of a sudden, all these, I'm not going to say haters, but whatever you want to call them, trolls, haters, come out, boom, you must be doing this, you must be doing that. There is no possible way you can stay lean and be muscular at the same time. You've got to be on some sort of drug, right? And so that's always prevalent on any channel. I get it too. I've had people, telling me all these list of drugs I'm supposedly taking, right? A whole bunch of them, all these things, not just testosterone, but other things to get cut and all these things, right? And they're adamant about it. They really believe I'm doing this stuff. That's the only way that they can comprehend me being like this, right? They don't think that perhaps it's diet and training. They just, and maybe a certain amount of genetics, but I don't think my genetics are that any freakish than anybody else. I just train really hard and I eat well, okay? So
I don't know. Is this guy not on TRT? Like, I don't understand. He is on TRT, right? For sure, 100% he is. Because look at him, and I don't mean to blow him up, really. Like, I did not start this video meaning to, like, blow this guy up and, like, put him on blast for all this stuff. Like, do your thing, brother, respect. But he's over 40 years old, and the guy is, like, jacked. Like, he's fine, he's not jacked, but he's, like, he's got very full looking muscles and he's like super lean. You know what I mean? There's not a lot of guys who are over 40 years old who are in this kind of shape, and he's not like preparing for a show or anything. He just walks around in this type of shape all the time. So it's like, how can you say that there's no benefit, right? Like, how is that possible? How can you justify that? And you could say that there's no benefit to somebody who's doing this when you're doing minimum 2 times what your body would actually produce. And again, like I said, to be fair, I don't care, right? I'm not like, oh, shut down the TRT clinics. I'm thinking for myself. And the reason I'm thinking for myself is I'm thinking, okay, if I do 100 milligrams a week, that's twice what my body would produce normally. I'm probably going to feel really good. I'm probably going to get like gains, and I'm going to my life is going to be better overall in like all these different ways. But there's got to be a catch. There's got to be like something on the other side of this where I'm going to be dead at like 60 years old or something like that, right? There's no way that this is like a free lunch. Do you guys understand what I'm saying?
Okay, because their levels of testosterone are at the same balance or threshold as anyone else, any natural person who's within the normal ranges. And people in the normal ranges can be on the low and high end as well. Some people naturally can be over the high levels. There definitely are people with elevated levels of testosterone, and they potentially do a little better in the gym, but it's not crazy night and day. Like, they're not like bodybuilder crazy. They just maybe can train a little less and get better results, right? That's all we're talking about there. So no, there's no advantage. And to give you an example, this may drag this review or this information video out a little bit, but to give you an example, let's use 2 race cars. Okay, 2 race cars. They're built exactly the same engines, the same car. They have turbochargers. So in this case, the turbocharger is kind of going to be like your testosterone. Okay, what a turbocharger does is it takes back pressure from your exhaust and changes that over into air pressure going into the engine, which puts more air into the engine, which allows for more gas, which allows for a bigger explosion. But turbochargers can be adjusted in how much pressure they deliver to the engine. So you have 2 cars exactly the same, both have the same turbos, they both have the same engines, both drivers are just as good, they both perform the same. But one turbocharger isn't performing enough. That would be like the TRT person whose natural testosterone isn't producing enough. So in this case, the turbo settings are a little bit low. They're not adjusted up to the right amount of pressure.
All right, and then he goes into this whole example about the turbocharger and the race cars and like all this stuff. And really, like, I don't want to like get into that example because in my opinion, it's not a good metaphor for like something like, it's not a good metaphor for TRT. It's just not. Because like I said, at the end of the day, your body produces 50, you're injecting 100 or you're injecting 150. How do you justify that? And really what it comes down to, the conclusion that I'm drawing from this is that just because your levels are within the normal range, that's not telling the entire story, right? That's not painting the entire picture. There's something else either that like the medical community has not discovered or like the scientific community still doesn't know about yet that is not explaining why all of these people who have like great musculature at an age where they should not, when they're only, I've never seen his workout, but like, the proof is in the pudding. These people work out hard, I guess. I'm not taking anything away from them. But like there are people who work out, I'm sure, just as hard and they don't have those types of gains. The difference is the exogenous testosterone. So, and the reason that it's explained away in terms of like, oh, well, my levels are within the normal range, so I guess it's okay, is because like the example that he gave earlier with the bodybuilders who will do 2 grams a week, their levels are like, if 400 to 1100 is in the normal range, the bodybuilder will have levels of like 2000 or 2500 or 3000 or something like that, right? So that's their justification. It's like, well, the bodybuilder is blasting 2 grams a week is at 3000. I'm only at 750. So I guess I'm normal. I guess this is a free ride. I guess, like, you know, doing 150 or 200 milligrams a week is okay because I'm within the normal range, and we don't need to talk about it any more than that. Don't ask any more questions. Do I have an advantage in the gym? No, of course not. You know, unless the doctor is accidentally prescribing me more than to get me in the normal range. But, like, you know, I don't know. It just, again, like I said, at the end of the day, it just comes down to your body produces 50, you're injecting 150, you're injecting 3 times what your body would actually be able to produce. On the test, sure, maybe it shows that you're within the normal range. Maybe on, like, okay, the high end of the normal range, whatever, you're still injecting 3 times more what your body would actually produce normally, which is fine. I'm all for it. Like, it sounds great. Sign me up right now. But the question is, what is the price that you're going to have to pay? And I'm not talking in dollars. Like, what is the price? And I don't see that addressed enough in these videos about TRT when I'm doing this research. I just don't see it addressed enough. I see these things explained away like, oh, well, I'm in the normal range and I guess it's okay because my doctor said it's okay. You know, they explain it away in terms of being in the normal range. They explain it away in terms of the doctor prescribed it. They make a straw man argument because, well, bodybuilders do, you know, 1.5 grams a week, so I guess I'm okay. You know, oh, well, I got my blood work done and, you know, everything came back good, so I guess I'm all right. So, like, I just don't, there's got to be something else that I'm not seeing here, and I don't know what it is.
So that's what we're looking at here. TRT does not, now the only time that TRT would be an advantage is if somebody's, you know, taking more than they should. So their doctor is prescribing more than they should be on, maybe either by accident or on purpose. It does happen either way. Like, sometimes maybe doctors aren't regulating what their patients are on and they're not checking their levels. They usually do. They usually get them checked out. But perhaps sometimes it doesn't happen that way and that person might be above average significantly. But it would have to be significantly for them to notice a real benefit, right? So it does happen, obviously. You know, with all good things, when people will take advantage of TRT, especially in professional sports. They'll get on TRT, doctor prescription, to get testosterone, right? So that these drugs show up in their systems if it's allowed in that sport, because testosterone is synthetically produced. There's a byproduct, so people can tell when people are taking it, not just by the elevated testosterone in their body, but by some of the other byproducts that are produced by it. They can see that it's been in their body. So again, you know, some people will take advantage of the testosterone, TRT replacement therapy, because they're going to use that loophole to get a boost or an increase to have an advantage. So of course that happens, and, you know, potentially that could happen for just a non-athlete or a non-sport person who's maybe using TRT, and maybe their doctor's giving them a little bit more just to get a little boost so they feel a little better in the gym. But again, you know, it's not the same, not even near the same levels of what people on your bodybuilding steroids, their cycles, they're taking orals, they're taking all kinds of things, right? It's a whole different thing.
So he just spent all of this time saying how TRT won't give you an advantage in the gym. And then he says, well, actually, sometimes professional athletes will get on TRT to get an advantage. So, like, which one is it? And again, I don't want to blow him up. Like, whatever, bro, do your thing, make your videos, it's all good. I'm just thinking for myself, like, you know, what is the price that you're going to have to pay in the end? You know, what is it actually? What is it? And I don't know. And this video, unfortunately, did not answer that question for me. But that's pretty much all I have to say about that. But yeah, I don't know. I think TRT is very interesting. I've been very interested in testosterone replacement therapy for a while. I'll probably still try it out anyway. Because yeah, I just kind of want to try it. And one more thing, if you are living a healthy lifestyle, you're eating the right foods, you're exercising on a regular basis, you're not abusing alcohol or drugs or anything like that, you are going to have, and you're sleeping and whatever, you're doing everything right, barring some sort of genetic defect that, like, who really has those? Come on. You are going to be producing a normal amount of testosterone for your age. And that really begs the question, okay, let's say you have somebody who's fit, who's healthy, who's doing everything right, and they start taking exogenous testosterone anyway, is that going to help them, really? Because like this guy does not seem like an unhealthy dude. You know, I'm sure he was fit before he started doing TRT. He's like a personal trainer or something like that. And there's a lot of other guys who are like this, where they're just like, they've got a healthy lifestyle going, and then they just get on a tiny little bit of test just to like give them that extra little boost that they need to get the type of results that they used to get when they were like, you know, 18, 19 years old. That's fine. Great. Wonderful. I love it. Like, sign me up. But again, I don't want to harp on this, but like, what is the ultimate price, right? It's very similar to ADD medication, right? Anybody who's ever studied for a test for college or something like that, like, you know, I don't know, correct me if I'm wrong. I remember, and I don't have ADD. I am like super good at sitting down and focusing and studying and like spending hours at a time on a single task without ADD medication. But you give me a Ritalin, you give me an Adderall, you give me a Dexedrine, you give me something and you tell me to go like study, I will study way better, way more efficiently. But I'm not diagnosed with ADD, so like, why is this medication working? It only works for people who have ADD. It's ridiculous. It's just like a loophole, kind of, so that people can get it without actually talking about what it really is. Because most doctors who prescribe this kind of thing, and this goes for TRT as well, I believe, most doctors who prescribe this have never actually tried it themselves, which explains their lack of knowledge. So they just prescribe it to get their patient out of their office. And the ones who actually are on the ball and do know about it probably use it and use their, you know, leverage as a doctor to do what I'm sure they believe is the right thing to do for themselves and their patients. Anyway, that is it. My long-winded analysis of TRT. Again, no disrespect to this get fit over 40 guy. I just thought this was a good example of a video that did, no offense, a poor job of accurately explaining the long-term risks and the reality of whether or not somebody who is otherwise healthy and fit will experience an incredible benefit from doing TRT. So that is it. What do you think about it? Are you curious about it? Should I try it anyway? I probably will. Let me know. Leave me a comment. Peace.